Hello, my name is Bryant Hansen. I'm a physician assistant at Grand Peaks Medical. I have been practicing general family medicine for about 7 years, and today I'd like to talk to you a little bit about cancer screening recommendations. What cancers do we screen for? When do we do that? And why? One of the interesting and ironic things that I sometimes see practicing family medicine is I have patients coming in with certain symptoms such as I feel tired, or I have a lump here, or I have a pain here, and they automatically think the worst case scenario, which is cancer, and they say, "Doctor, do I need to be worried? Is this cancer?" And most of the time I get to tell them, no, this is not cancer. But on the other side of that, I also have patients coming in for general wellness or physical exams, and they feel fine and they have no symptoms. And I talk to them about these cancer screening tests, but they refuse, saying, "Doctor, I feel fine, I don't have any symptoms, I don't want to get these tests done." The ironic thing about that is that most cancers, especially in their early stages, do not cause symptoms at all. And so we're going to talk about what the recommendations are, how old you need to be to start screening for these cancers, which, like I said, usually do not cause any symptoms. And so these are tests that everybody should be screened for. Before I go into the specific cancers, I should say that these recommendations that I will be talking to you about are for the general average population that are considered average risk for cancer. There are a lot of exceptions to these recommendations in people who have certain genetic predispositions or a strong family history of such and such cancer, but these are just the general recommendations for those at average risk. So the first cancer I'd like to talk about is cervical cancer screening. The reason I would like to start with this one is because it's the one that we recommend starting screening at the earliest age. And so this is for younger women starting at the age of 21. This is a test that is recommended in women regardless of being sexually active or not. Sometimes we're a little more conservative in that way, and that we will have women wait until they become sexually active. But the national recommendations are to start cervical cancer screening starting at age 21. This is done by doing a pelvic exam using a small speculum that is inserted into the vaginal canal, finding the cervix, and using a small soft rubber brush to get some cells off of the cervix, and that is sent off to the lab to be checked for cervical cancer. This is one of the best screening cancers for any type of cancer out there, because not only does it do a great job at catching cervical cancer early, but it also will tell us if there's any early changes of cells that are precancerous. So not only does it screen for cancer, but it also prevents cancer, because there is treatments that can be done to get rid of those atypical or abnormal cells before they have a chance of turning into cancer. And so from ages 21 to 29, the Pap smear should be done every 3 years. And then after that, we add an additional test onto that little swab that we get called an HPV test, which stands for human papillomavirus. That is a virus that women can acquire that does increase your risk of cervical cancer. And so by doing that test, and if you test negative for the HPV virus, then we only have to do the Pap smear every 5 years. And we start adding that test on at age 30. So ages 30 to 45, we add that HPV, you only have to do that every 5 years. And then your risk of cervical cancer actually goes down as you get older, which is unusual for most types of cancers. It usually goes up as you get older. And so that is why we start this screening early on in your 20s and in your 30s. And then once you hit the age of 65, it's no longer recommended to get these cervical cancer screenings. The next cancer screening test that I'd like to talk about is breast cancer screening. That is also something that is extremely common and very, very important to be screened. In younger women, ages 21 to 40 years of age, there's no specific imaging study that's recommended for that age group, but it's very important to be going in to your regular medical provider on an annual basis to get a breast exam. And also, throughout the year, being what we call breast aware, which means that you're every once in a while when you're thinking about it, when you're in the shower or otherwise, just feeling your breast tissue with the palm of your hand into your armpit up to your collarbone here, and making sure that there's no changes. And a big part of that is just being aware of what your regular breast tissue feels like, and if there's anything different or if there's anything that changes, then you can go in and see your medical provider to get that looked at to make sure there's nothing to worry about. Once you turn 40 years of age, it's a little bit of a gray area when you're in your 40s of whether you should start doing a mammogram or not. And we do what's called an individualized approach with this, depending on how the patient feels about it and if they're at a higher risk for breast cancer. In general, we do not recommend doing mammograms until you turn the age of 50, but there are a lot of exceptions to that, and sometimes you do need to do it when you're in your 40s. And so that's a good thing to talk to your medical provider about. Once you turn 50 years of age, and all women over the age of 50, you should start to do a mammogram. In the slide, it shows a picture of what a mammogram machine looks like. It's very similar to getting an X-ray done. It's very painless and it's very quick, but it can be a life-saving procedure to get done. And it's recommended to do that every 1 to 2 years, starting at the age of 50. And that being said, once you start doing mammograms, it's also important to continue doing those annual breast exams from a medical provider and being breast aware, any of those changes as well. The next cancer is colon cancer screening. The recommendations and the gold standard of treatment for colon cancer screening is doing a colonoscopy when you turn the age of 50. A colonoscopy is a small camera that gets inserted through your rectum into your large intestine, and they look for any growths or what we call polyps, which are small little tumors inside of the colon. And as long as that colonoscopy is normal, you only have to do that every 10 years. And once you get into your 70s and for sure into your 80s, it's no longer recommended to do a colonoscopy. So as long as your colonoscopy results are normal, you really only have to do that 2 or 3 times in your lifetime. A lot of people are scared and apprehensive to do this test, but it is actually much easier and simpler than you'd probably think it is. They give you a medication that is lightly sedating so you do not feel any pain, and usually when you wake up from that procedure, you don't have any memory of it at all. You take a small medication the night before that helps cleanse out your colon. You'll have some diarrhea for a few hours to prepare for that colonoscopy. Most people say that's the worst part of it, is just having to deal with diarrhea for a few hours, but it's really not as bad as you'd think it is. An alternative to a colonoscopy is a test called a HemoSure test. There's a lot of different products and brand names for that, but at Grand Peaks Medical, that is the test that we use as an alternative to a colonoscopy. Basically what that is it's a kit that we send you home with where you leave a small stool sample and you bring it back to our lab, and we check for any microscopic blood tracings that may indicate that you have colon cancer. This is a very sensitive test, meaning that if there's any abnormalities in your colon, it will show up as abnormal on the HemoSure test, but is not specific for colon cancer. So if it does come back abnormal, then we don't know for sure if you have colon cancer or not. You'd have to go in and get a colonoscopy to know for sure. If you have a HemoSure test done, that needs to be done annually instead of every 10 years. If you do not have insurance, then a HemoSure test is also a much cheaper alternative than having that done. And in general, all of these tests that I'm talking about, all of these cancer screening tests, if you have any basic insurance, they're very well covered as part of a preventative type measure. And so financially speaking, it's usually not a huge barrier to go through. The last cancer screening test I'd like to talk about is lung cancer. This is a newer recommendation out there that many people may not be aware of. And this is not something that everybody needs to be screened for. It is just for patients who are at risk of developing lung cancer, meaning people who have a history of smoking. And so if you have what's called a 30-pack year, meaning if you've smoked a pack of cigarettes a day for 30 years, and your age is 55 to 75, then it's recommended to be screened for lung cancer, whether you have symptoms or not. And that is done with what's called a low-dose CT scan. Low dose meaning it uses low radiation than a regular CT scan would use, but it gives you a very detailed imaging of your lungs and would be able to catch any abnormal growth or mass in there. Also, if you're a former smoker and it's been within 15 years since you quit smoking, it's also recommended to get that low-dose CT scan to screen for lung cancer. Obviously, the most important thing in prevention and decreasing your risk of developing lung cancer is to quit smoking. And that's something that we are very passionate about at Grand Peaks, and we love helping people get off of tobacco use. This next slide talks about some other fairly common cancers that we talk about a lot in our practice that do not have any standardized screening recommendations for them. The first one is prostate cancer. There used to be recommendations that we were supposed to screen every male over the age of 50 for prostate cancer, but that's no longer the recommendation because the test for that is not very accurate. We're getting a lot of false positives for that, but it is very simple to screen for prostate cancer. It's just a little blood test that we can draw there in the office, and it takes a couple of days to get the results back on it. But we do not recommend screening for prostate cancer unless you are at risk for it, or if you're having urinary obstructive symptoms, meaning if you're having to wake up at night several times at night to urinate, or if you don't feel like you're emptying your bladder completely when you urinate, or if your stream is weak when you urinate, those types of things, that could mean that your prostate is enlarged and you should be screened for prostate cancer. And so that is also something that you should talk to your medical provider about, whether you should be screened for prostate cancer or not. And certainly if you're having those symptoms, you should be screened for that. The other one is skin cancer. As part of a general wellness exam, that is always something that you should be mentioning to your provider, your medical provider, about doing just a general skin check, checking all your moles to make sure that there's no abnormalities there. And then also being aware if you have any dark moles or moles that are changing in size, you don't want to ignore those. You want to get those looked at to be treated early on. Ovarian and uterine cancers, there's no specific screening for those, but as part of an annual wellness exam for women, when we do those pap smears, those cervical cancer screening tests, at the same time we also do an exam called a bimanual exam where we feel the ovaries and we also feel the uterus to make sure there's no abnormal enlargement, there's no tumors or anything obvious there that would need to be looked at in more detail. That's obviously not a perfect test for it, but it is something, another reason why you should be coming in on an annual basis to get those general wellness exams. The last thing I'd like to say about these cancers is that if you're having any symptoms at all, it's normal to be worried about cancer. It's natural and normal for our bodies to immediately go to that. Most of the time it's not cancer. But if you are having a symptom that is persistent, that's not going away, you do not want to ignore that symptom. You want to make sure that you get it checked out. Come to Grand Peaks Medical, tell us what's going on, and we're happy to help you in any way that we can. So that is all for the cancer screening recommendations presentation. Thank you, and please call our office or send us an email if you have any questions or concerns. Thank you.